Thank you. This is my first time to this meeting, and it's truly a big honor. I do take care of some of the patients with the conditions, and I thought that this will be a good topic because there's just little is known about the eyes. I'm going to be talking about not just in patients with SCN2A, but just eyes in general. So I think you will have a good idea of why the eyes are important in this particular condition, but also for children as a whole. So thank you. Objectives. I'm going to talk about the eye anatomy. I can't, this is something that I just can't teach enough. In medical school, most of the doctors, unfortunately, do not give enough training in eyes. And so when they have any eye issues, it's hard for them to really relay the information to the parents or the children or anyone. So hopefully I could make all of you my ambassadors. After today, you'll have a much better understanding about the eyes and how it impacts so many children with patients with SCN2A, and then and talk about what you should do. Okay, first, I'm gonna see if I could have a laser. Okay, perfect. I'm gonna be over here. So the light, actually, most of you are on this side, so I'm gonna use this one. So the light is reaching the cornea. The light is moving from the right to left, and it hits the cornea and hits the lens, and then it hits the retina. So that light visual pathway has to be clear for you to see clearly. And that information gets transferred to the brain. And before it goes to the brain, fortunately, we have two eyeballs, right and left. And the right eye has 6 muscles, and left eye has 6 muscles. And this is extremely important as we move forward. So please remember that, okay? So it's the combination of these 12 muscles that help us to see clearly without seeing double. So, and it's extremely important from birth. From birth to about 7 years of age, the eyes have to be straight, and also the visual pathway has to be clear for the brain to develop. So this is what normal parts of the brain looks like. Is that particular part of the brain is called lateral geniculate nucleus. And you can see one on the left, one on the right. Okay? But if patient do not see clearly, for whatever reason we're going to talk about, from medications, misalignment, or seizures, then that can impact the brain, and then we can see it by looking at the eyeballs. Because remember, I just told you that visual pathway is clear to the optic nerve and the retina. So by me looking at the retina, I can indirectly see what's going on the brain. So if the eyes are, for example, misaligned, or there's a opacity, there's something's blocking it, then that normal parts of the brain that we call lateral geniculate nucleus, or LGN, by the way, it's the largest nucleus in your body. It's that important. Becomes this. It atrophies. But fortunately, if you can reverse whatever that's causing a decrease in the vision, then you can make that brain back to normal. But there's a time limit. It's about 8 years of age. So you got to correct this problem before the age of 8. Now, then you may say, what are the things that can cause lazy eye? Misalignment, or we call it strabismus. It means that the eyes are not straight. Or refractive error. I see about a third of you wearing glasses right now. If you don't wear your glasses today and came here, you'd be annoyed. But if a child does not wear the glasses at the right time, the brain atrophies. So if you start wearing glasses after the age of 8, then it's too late because the brain already had atrophied. Does that make sense? This point, please take this home. So the correct term is actually lazy brain. So imagine you going to an eye doctor and your eye doctor saying, your child has a lazy brain. Obviously, that's going to upset a lot of parents. We don't use that term. We just use euphemism, lazy eye. But lazy eye is a complete misnomer. Please remember that. Just like cortical visual impairment, like we're going to talk about that in just a little bit. CVI is a misnomer, but it's a euphemism. Okay? So how do we treat it? We use patches, glasses, sometimes eye drops, sometimes glasses with prisms, or we actually put prisms in the eye, or we use Botox. As a matter of fact, please remember this too. Botox that many ladies use today were actually invented for eye muscle surgery. Please remember that too. So that's the second thing you're going to remember. Okay? Or you can do surgery to straighten the eyes. Now, here's a child with a misalignment, and we can straighten it with a pretty high success rate. So now we're going to talk about the ocular manifestations of patients with SCN2A. So what does all these things that I've talked about got to do with our patients? Patients with the conditions have it's well known, higher incidence of lazy eye, amblyopia, either because of the eyes tracking not together, or they have a refractive error. They can't see. Or they have misalignment of the eyes, which may or may not be related to the seizures. Because seizures is an abnormal brain activity, and I just said, significant portion of the brain is connected to the eyeballs. And we can see what's going on in the brain by looking at the back of the eyes. Or because they have nystagmus, eyes are jumping. Especially this can happen right before seizures. Also, they have problem with depth perceptions, or the optic nerve, which is the cable that connects the eyeball to the brain, may be abnormal. If the cable is not working, it doesn't matter how well you see with your eyeballs, brain's not going to recognize it. And vice versa. And then CVI, we're going to talk about. Okay, how do we check the vision? In kids who are verbal, who can cooperate, we use charts. But in patients with autism or other types of developmental issues, they cannot. So we have special charts developed for that. It's called Teller's card. But there are many variations of Teller's card with alternating patterns. So we show them different patterns and see which chart they prefer to see. And based on that, we can approximate their visual acuity. Okay? So this is what 2020 looks like. So what that means, now this is the third thing I'm going to teach you. 2020 means what the average people see at 20 feet away, you can also see at 20 feet away. But if you have a 2200 vision, what that means is that what the average person see at 200 feet away, you have to be at 20 feet away. Does that make sense? Okay. The bottom number is the average population. Top number is you. So if you have a 2400 number, obviously that's going to be worse. Okay. So higher the lower number, poor the vision. Now, nystagmus. That's when the eyes are shifting and jumping. Now, there are many different patterns. And by looking at the patterns and the way they shake, we can sometimes isolate the lesion where the problem is in the brain. Whether if it's downbeating, then we know there could be a problem in the cerebellar area. If it's upbeating, then we know that it's most likely in the frontal area, and vice versa. And then also there is a rotary component. And also it can have a horizontal component. All of those things will compromise your vision. Here's an example. Here's a child comes in with the head turn, due to a nystagmus. So patient prefers to look to the right. And when patient tries to look to the opposite direction, the eyes start jumping. Or patients who are taking vigabatrin for seizures, and if you start having peripheral vision problems, they may start acquiring different head postures because their peripheral vision is being compromised. So here's a patient looking at this picture, looking straight ahead, it's blurred, but when the patient is looking to certain direction, it looks clear. And then when they try to look in opposite direction, it gets really blurred. And from the patient's perspective, sometimes it's just subconscious. And so they're walking out with the head turns. So when we put them in school, we make recommendations of where they should sit, depending on which gaze they prefer. So if they have problem in left gaze and prefer the right gaze, then we have them sit on the left side of the classroom, preferring them to look to the right. Eye tracking and gaze patterns. I apologize. I think I will try to finish in 20 minutes. So I'm gonna go pretty fast. So, and then we also look at eye tracking and gaze patterns. So we have different technologies that's available, and we look for saccades. When we say saccade, it means that when you're looking to the left to right, the eyes have to fixate quickly. That's called saccadic movement. If you're moving your eyes slowly as you're reading something, then we call it smooth pursuit. Okay, so we look at those things. And also we look at their pupils. And patients with SCN2A typically have dilated pupil. The reason for that is because they have a atypical autonomic nervous system. What that means is that when you're trying to focus on something close, your pupils normally have to contract and become myotic, small. But in patients with this condition, typically don't have that autonomic regulation. When I'm sitting here right now, we got those lights coming right at my eye. It's bright. I don't want all that excess light in my retina. So it's a protective mechanism. So my pupil is constricted right now. But in patients with this condition, either from medications or from autonomic dysfunction, have dilated pupils. So they're going to be looking away because it's very, very, it's uncomfortable. It's a reflex. If they have a refractive error, we can tell. I get this question a lot. Like, how do you know? How do you have them sit in front of a phoropter and go 1 or 2, 1 or 2, which is better? No, we don't do that. By me actually standing right here, I actually know many of you refractions already. I already know your prescriptions. I already know whether you're farsighted or nearsighted, and I know what you can and cannot see without your glasses. Standing right here. So there are lots of tools that we use to determine the refractive error of babies. You've seen those babies with glasses, right? We can tell within seconds they come into the clinic. Is that cool? I think it's cool. Also, I'm going to just briefly talk about cortical visual impairment. This term is actually relatively new. It actually, years ago, this term didn't even exist. So this term was mainly used for patients children who are showing abnormal vision that cannot be attributed to the eye problems, meaning the eyes are straight, no refractive error, but patient is not able to see well. That's it. But the term cortical means that there's something wrong with the brain, specifically the gray matter. That's the cortical portion of the brain. But we know now that's not true. Cortical visual impairment can encompass so many different conditions. Please, that's the fourth thing you guys are gonna remember. There's so many different things that can cause CVI. I don't have the time to go over everything, but just in general, broad neurological involvement, and also the cortical visual impairment. When we use a term, the eye to the brain, the image gets sent from the eyeball to the occipital lobe. And then from there, it goes into the frontal lobe for it to be interpreted. So when I'm looking at an image, I'm not just simply looking at the image, but that image correlates with emotions, memory. There's so many other things that's associated with images, that particular image. That's about 75% of the brain. Not just a cortical area, but it involves pretty much the significant portion of the brain. So it can actually be patients with epilepsy, with the abnormal activities. Any parts of the brain can cause manifestations of strabismus and vision issues. Patients with hypoxic ischemic encephalopathy. That's actually a very common condition in babies born premature or born too late, and with the hypoxia, with a lack of oxygen to a particular part of the brain. Periventricular leukomalacia. It's another common condition that many healthy babies have that they don't even know they have it. And then traumatic brain injury from a car accident, whether it's from an abuse, whether it's from shaken baby syndrome, and metabolic disorders with hypoglycemia, infections, viral infections can all cause these things. And the symptoms can vary significantly depending on the etiology. And also, when I look at the optic nerve, that optic nerve, remember, is a cable that connects the eyeball to the brain. By me looking at the optic nerve, I can tell indirectly of what's going on in the brain, whether the brain is healthy or not healthy. If the brain is not healthy, if that 70 to 75% of the brain that's connected to the eyeball is not working correctly due to a retrograde optic nerve involvement, the optic nerve can become pale. And that's how we can tell if someone has increase in brain pressures or brain tumors or hydrocephalus by looking at the back of the eyes. Or if patient has hypoxic ischemic encephalopathy, ischemia, okay? And so these patients with CVI, as you can see, there's so many different conditions that can manifest as CVI, but before we make the diagnosis of CVI, they need to have a complete eye examination. Make sure they don't have a refractive errors, they don't have strabismus, optic nerve issues, and those things are all addressed. And then, of course, there are many specialists or people that focus on CVI that can help you. It's truly a multi-team effort to address these patients with CVI, because if you come to me as a pediatric ophthalmologist trying to address CVI, in terms of the treatment, that's not something that most pediatric ophthalmologists specialize in. We can help you to make a diagnosis, but we are not someone that can help with the treatment. And I know there's a talk, I think, that was given already or will be given later that will focus on that. So I'm going to defer to that. But it's truly, I want to just mention this, it's a truly multidisciplinary care. And as a matter of fact, through the American Academy of Pediatrics, we're coming out with a statement on CVI because it's way overdue. So that's going to be coming out very, very soon. Thank you very much for your time, and I really thank you for this opportunity, and I look forward to answering any questions later. Thank you.